For your ISD Drug Testing Orientation, 2017-2018. Purpose of orientation: to inform students and parents of the policy and procedures of the Freer ISD drug testing program. To educate students regarding the harm caused by the use of drugs or alcohol. Scope of policy: any student in grades 6 through 12 who chooses to participate in school-related activities must participate in the district's drug testing program, which consists of random drug testing throughout the school year. Purpose: to prevent injury, illness, and harm resulting from the use of drugs or alcohol. To help enforce a drug-free educational environment. To deter student use of drugs or alcohol. Use of results: drug test results shall be used only to determine eligibility for participation in school-related activities, not be used to impose disciplinary sanctions or academic penalties. Confidentiality: results shall be confidential and shall be disclosed only to the student, the student's parents, and designated district officials. Results shall not be maintained with a student's academic record. Results shall not be otherwise disclosed except as required by law. Testing: Pinnacle Medical Management is currently approved to conduct random drug and alcohol testing. This is the only company that can be used for the testing. Substances tested for: alcohol, cannabis, cocaine, benzodiazepines, phencyclidine, barbiturates, propoxyphene, amphetamines, opiates, synthetic cannabis, and metabolites of any of these substances. Random testing: random tests shall be conducted throughout the school year. The drug testing laboratory shall use a random selection method to identify students chosen for random testing. Students shall not receive prior notice of the testing date or time. Refusal to test or tampering: a student who refuses to be tested when selected or who is determined to have tampered with a sample shall be deemed to have a positive test result and shall be subject to the appropriate consequences depending on previous positive test results, if any. If a student is absent on the day of the random test, they will be tested on the next random testing day. Positive test results: upon receiving results of a positive drug test, the district shall schedule a meeting with the student's parents, if the student is under the age of 18, and the coach or sponsor of the school-related activity to review the test results and discuss consequences. The student or parent shall have 5 school days following the meeting to provide a medical explanation for a positive result, if any. Medical explanation: a student may have a prescription for some of the substances tested for. The prescription must be written for the student and must be current. Warning: students are discouraged to take any prescribed medication that are not prescribed to them. Consequences: consequences of positive test results shall be cumulative throughout the student's enrollment in the district. This means that results that occurred in junior high will transfer over to high school. An example: if a student tests positive twice in junior high, those 2 positive results will transfer to when they are in high school. First offense: the student shall be suspended from any school-related activity for 30 school days following the date the student and parent are notified of the test results. During the period of suspension, the student may participate in practices but not in any competitive activities, barring any health risk and only with written doctor's permission. The student and/or the parent will be responsible for the cost of obtaining a doctor's permission. Retesting. If the student wishes to return to participation in school-related activities, the student must be retested at the end of the period of suspension and have a negative test result. The student shall be retested on the next 3 random test dates. Drug abuse prevention. The district shall notify the parent and student of drug and alcohol abuse prevention resources available in the area. Second offense. The student shall be suspended from any school-related activity for 90 school days following the date the student and parent are notified of the test results. The district shall again notify the parent and student of drug and alcohol abuse prevention resources available in the area. Third offense. The student shall be suspended from participation in any school-related activity for the remainder of the student's enrollment in the district, following the date the student and parent are notified of the test results. End of semester suspensions. If a student's suspension from participation is not completed by the end of the semester, the student shall complete the assigned period of suspension during the following semester or during the first semester of the following school year. Appeals. A student or parent may appeal a decision made under this policy in accordance with FNF Local. The student shall be ineligible for participation in school-related activities while the appeal is pending. For more information on our district policy, please refer to Student Rights and Responsibilities, FNF Local. Alcohol. Alcohol affects every organ in the body. It impairs brain function and motor skills. Heavy use can increase the risk of certain cancers, stroke, liver disease, and heart problems. Cannabis, also known as marijuana. Short term, it can cause altered perceptions and mood, impaired coordination, difficulty thinking and problem solving, disrupted learning and memory. Long term, it affects brain development, affects thinking and memory. There is a link between marijuana use and mental disorders, and it can cause respiratory problems. Cocaine. Short term, it's highly addictive, causes dilated pupils, increased body temperature, increased heart rate, increased blood pressure, nausea, increased energy and alertness, euphoria, and decreased appetite and sleep. Long-term, cocaine can cause addiction, restlessness, anxiety, irritability, paranoia, panic attacks, mood disturbances, insomnia, nasal damage or difficulty swallowing from snorting, or gastric problems. Benzodiazepines and barbiturates. Short term, it can cause central nervous system depression, drowsiness and relaxation, overdose. Long term, it can cause tolerance, physical dependence, addiction. Withdrawals can have life-threatening complications. Examples of benzodiazepines and barbiturates are Ativan, Valium, and Xanax. Phencyclidine. In low doses, it can cause shallow, rapid breathing, increase in heart rate and blood pressure, nausea, blurred vision, dizziness, numbness, slurred speech, confusion, loss of coordination, muscle contractions, analgesia, altered perceptions, and feelings of being separated from one's body. In high doses, PCP can cause feelings of invulnerability or exaggerated strength, seizures, coma, and hyperthermia. Hyperthermia is increase in body temperature. Propoxyphene and opiates. Short term, it can cause pain relief, drowsiness, nausea, constipation, euphoria, slow breathing that can lead to coma or death when taken by routes other than as prescribed. Long term, it can cause tolerance and addiction. Examples are oxycodone, codeine, hydrocodone, and Vicodin. Amphetamines. Short term, they can cause increased alertness, attention, and energy, irregular heartbeat, dangerously high body temperature, potential for cardiovascular failure, and seizures. Long term, it can cause anxiety, hostility, paranoia, psychosis, and addiction. Examples of amphetamines are Adderall, Ritalin, and Concerta. These are medications that are sometimes prescribed for ADD or ADHD. In low controlled doses, these medications can be beneficial. It is when the medications are misused that you see the above symptoms. Synthetic marijuana. Some reported effects include elevated mood, relaxation, altered perception, extreme anxiety, paranoia, hallucinations, rapid heart rate, vomiting, agitation, confusion, elevated blood pressure, and heart attack. Consent form. Parents must sign a drug testing consent form and return it to the nurse's office. Please list the name or names of your child or children in grades 6 through 12 that are being allowed to participate in the Freer ISD drug testing program. Consent forms can be signed at the junior high, high school, or the nurse's office. Student orientation. Students will receive the drug testing orientation during school hours. Students will complete the student consent form during the drug testing orientation. The consent form is proof of attendance and must be turned in at the time of the orientation. No late forms will be accepted. Removal of privilege. Failure to complete the drug testing orientation requirements by the student and/or parent may result in the removal of the privilege of participation in any school-related activities, including practice and competition. Questions. If you have any questions or concerns, please contact Mary Alice Cantu, Director of Health Services, or Lori Reese, the Freer High School and Freer Junior High nurse, at 361-394-6025, extension 181. Thank you.